Colleen Collins. This is my head, eyes, ears, nose, throat assessment for Advanced Health Assessment 1. And this is my sister, my patient, Caitlin.
Hello.
Okay, so I'm going to start by assessing her head. Have you had any tenderness in your scalp at all?
No.
Okay. Didn't notice any cuts or bruising in your scalp?
No.
Any swelling?
Nope.
No? Okay, and no tenderness as I palpate your head here?
No.
Okay, so the head is normal cephalic, no noted lesions, no swelling, no bruising. There's no dryness or flakiness of the scalp. I'm going to check on this side as well. Any tenderness down here in the neck as I press?
No.
Okay, perfect. Okay, so the head looks good, normal cephalic, no lesions, no bleeding, no bruising, no swelling, no tenderness, as per the patient. Okay, so now I'm going to check out your eyes.
Mm-hmm.
Have you had any visual changes recently?
No.
Or no blurry vision, double vision?
No.
Okay, perfect. Okay, so first thing we're going to do the Snellen chart, which I have placed in front of the patient, 20 feet in front of them. Okay, can you tell me which row you can read?
The last one.
Last row? Okay, please read the letters for me.
L, T, F, P, H.
Okay, very good. So 20 feet away, the patient has 20/20 vision. Good job. Okay, so now I'm going to turn the lights off so that I can take a look at the eyes.
Mm-hmm.
Okay, so first things first, I want you to just watch the monitor in front of you.
Mm-hmm.
I'm going to bring a light in front of your eyes, so just remain looking at the monitor. Okay, so as I put the light over top of her eyes, I see constriction of the pupil. The pupil is accommodating to light. Both pupils are round and reactive. Okay, I'm going to put the pen light up and close to your eye so that I can see what size your pupils are. And resting, her pupils are about a 4. Okay. All right, so now I'm going to take the ophthalmoscope. I'm going to take a deeper look into your eye. So I'm going to get closer to you with the light shining in your eye. You're still going to look forward, okay?
Okay.
Okay, so there's a positive cornea reflex on the right as well as a red reflex in the pupil. The optic disc is seen, it's a light yellow, as well as several veins and arteries going up to the optic disc. Now I'm going to take a look at the left side. Okay, and same thing, there's a cornea reflex as well as a pupil reflex, red reflex. There's veins and arteries up to the yellow optic disc. There's no bleeding and no swelling noted or lesions in the pupil. Okay, so I'm going to turn the light back on. Now I'm just going to examine your eyes. I am going to touch your face for a second. I'm going to check for tenderness. Let me know if it hurts at all when I'm pressing around your eye here.
Nope.
Okay. I'm going to have you look up as I pull your lower lid down. The conjunctiva in the left is pink and moist. The tear duct is intact. There's no swelling or lesions noted. Okay, and same thing, look forward. I'm going to lift up. And sclera is white with several blood vessels noted, no redness. I'm going to do the same thing on the right side. Tell me if there's any tenderness as I press around your eye here.
Nope.
Okay, I'm going to have you look up as I pull down the lower lid. Conjunctiva is pink and moist again. No noted lesions, no swelling, and no tenderness as per the patient. I'm going to have you look down as I pull the upper lid up, and sclera is white with several blood vessels, but no redness or swelling. And the iris is circular with no asymmetrical borders. Okay, now I'm going to stand in front of you, and I'm going to wiggle my fingers. I'm going to have you stare straight ahead at me, okay? All right. Actually, can you turn to this side?
Yeah.
Just so it's better. Okay, so I'm gonna have you look straight at me and I'm gonna wiggle my fingers from behind your head and you're gonna tell me when you see them. Okay? Alright, stare straight at me, tell me when you see them.
No.
Okay?
No.
Alright, and the other side.
No.
Okay?
No.
Okay, very good. Now I'm gonna have you cover your left eye as I cover my right, and we're gonna do the same thing. Stare at me as I wiggle my fingers, tell me when you see them.
No.
Okay? Tell me when you see them.
No.
Good job. And we're gonna cover the other eye. Do the same thing. Tell me when you see them.
No.
Okay, tell me when you see them.
No.
Okay, so now I'm gonna do your extraocular eye movement. So I want you to stare straight ahead. Look at my finger. Okay, now follow my finger with just your eyes, not your full head, okay? Okay, so in the H formation, the patient is following me with her eyes. There's no nystagmus, there's no lid lag. So everything's normal with the extraocular eye movements. Normal. Now I'm going to examine her ears. First things first, I'm going to do a hearing test. Have you had any changes in your hearing recently?
No.
Okay. Have you ever had difficulty hearing in the past?
No.
All right. No drainage that you noted?
Nope.
Nothing like that? Okay. So I'm going to just check out your external ear. The auricle is intact. There's no lesions. Is there any tenderness as I press around the ear?
No.
Okay. How about back here as I press on the mastoid?
Nope.
No pain
That's
there?
good.
Okay. And the ears are intact, no lesions, no swelling, no tenderness as per the patient. And now I'm going to check out the other side. Same thing, skin's intact, no lesions, no swelling that I note. Do you have any tenderness as I press back here on the mastoid?
No.
Okay. Any pain with this tragus?
Nope.
Okay. And on the other side, any pain with the tragus?
No.
Okay, perfect. I'm going to do a hearing test. So I'm going to press on the tragus of the right ear as I whisper something into your ear, and you're going to repeat what I say to you, okay?
Okay. Baseball.
Okay, very good. Now I'm going to do the other side. Apply pressure to the left tragus as I whisper something behind her ear.
1, 2, 3.
Okay, perfect. So the patient correctly repeated the words that I had whispered from behind her. Now I'm going to get a tuning fork and we're going to do the Weber test, which I'm going to hit this, it's going to vibrate, and I'm going to place it on top of your head, and I want you to tell me if you can hear it equally and feel the vibration equally on both sides. Okay? So you can just look forward for me.
Yeah, I hear it on both
Equal on both sides?
Yeah.
Okay, perfect. Now I'm going to do the same thing. I'm going to hit this, it's going to vibrate. I'm going to stick it on the bony prominence behind your ear, and I want you to tell me when you stop hearing it, and then we're going to put it up in front of your ear for air conduction, and tell me when you stop hearing it there. Okay?
It stopped. Okay.
Good?
Makes sense,
Okay.
yeah.
Very good. So she heard it longer for the air conduction than she did on the bony prominences, which is normal. And now I'm going to do the other side. Same thing. I'm going to put on the bony prominence behind your ear, and then I'm going to bring it forward for the air conduction, and you tell me which, if you can still hear it. Okay? So tell me when you stop hearing it here.
Yep.
Okay, so same in the other ear. The air conduction was longer than the conduction on the bony prominence, which is normal. Okay, now I'm going to examine her ears. So I'm going to use the otoscope. Okay. Now I'm going to do the left ear first. And to examine an adult, we pull the pin up and back. Okay, so I'm going to insert this into your ear. Okay, so there's a little bit of cerumen noted as well as the hairs. There's a pearly gray eardrum as well inside. And now to this side.
No, touch the screen.
Okay, and now I'm going to pull this pin up and back. Insert the speculum. Okay, and same thing on this side. There's a little bit of cerumen in the passageway as well as a pearly gray eardrum. Now I'm going to inspect your nose, which I am going to switch the Okay, so have you had any drainage from your nose, any congestion,
No.
any tenderness as I press on your nose here?
No.
Okay. From the looks of it, there's no swelling, no lesions, no drainage. Have you had any nosebleeds recently?
No.
Okay. So from the looks, the nares are equal and symmetrical. I'm going to press on your left nair and I want you to inhale. Any difficulty inhaling on that side?
No.
Okay, and now we're going to do the same thing from this side. No congestion, no pain with that?
No.
Okay, perfect. And now I'm just going to look with the speculum into your nose. Okay. So her nares are pink and moist. No noted bleeding or lesions on the inside. Okay. And now I'm going to take a assess your neck and throat. So from the outside, the lips are symmetrical. They're moist and pink. No noted lesions or swelling. I'm going to have you stick your tongue out and go, Okay, good. The hard palate on top is pink and moist, no lesions noted, and the uvula is midline. No noted swelling on the tonsils. I'm going to have you stick your tongue out and go from side to side with it. Okay, and lift it up. Okay, tongue is pink and moist. There's no noted lesions underneath the tongue or on either side. I'm going to have you pull down your lower lip for me. Okay, so gingiva is pink and moist, no noted lesions, no swelling, and the upper lip. Okay, mucosa is pink, moist, there's no lesions or swelling noted. Have you had any bleeding when you brush your teeth?
No.
Okay, good. And do you follow up with the dentist frequently?
Yes.
Okay, very good. Do you have any issues with your mouth? Any difficulty swallowing? No. And you said no bleeding?
Mm-mm.
Okay, good. Any cuts or anything that you feel that I might not have seen?
No.
Okay, very good. Now I'm going to check out your neck. So I'm just going to palpate either side. Is there any pain with me palpating over here?
No.
Okay. Underneath at all?
No.
Okay. And there's no enlarged lymph nodes, no lymph nodes palpable. Any pain back here
No.
or down here?
Nope.
Okay. What about in the middle here?
No.
Okay. Trachea is midline. The thyroid gland is palpable. Now I'm going to feel over here. Any noted pain, tenderness?
No.
Okay. Again, there's no enlarged lymph node. Skin is warm to the touch, intact. Okay, now I'm going to feel over your thyroid gland and I want you to swallow for me. Okay. Okay, thyroid is not enlarged and there's no nodules palpated. Any pain down in here?
No.
Okay, perfect. No tenderness as per the patient. Thank you very much.
Thank you.